My big suggestion to students, particularly through high school, is
You can do anything.
Choose it for you, not for it is worth
it.
Just focus on the next
Doesn't
step.
matter what you're doing.
Don't be afraid.
As long as you're doing
That
something.
is such good advice.
I don't think I could see myself doing
It's a
anything else.
challenging life.
Student nights, Wednesday to
Oh,
Saturday.
I worked on that house.
I racked up every single dollar of debt that I
I
possibly
think there's
could.
a lot of pressure on high school.
Yeah,
kids
I just
these days,
love
right?
working outside.
And if money is something that you care a lot
In
about,
hindsight, that
I've
was,
also been a very indecisive
But you
person.
keep looking for roads that have been less
It
travelled.
was just that moment that I knew what I wanted to do. So nothing else is going to change that.
Welcome to the guest speaker.
Today we welcome Jessica Totman, who is a passionate and dedicated physiotherapist whose journey into healthcare began with a clear vision at just 14 years of age. While many teenagers are still deciding what they want to do, you already knew physio was going to be your pathway. Throughout high school, you intentionally chose subjects like sports science and biology to earn entry into a Bachelor of Physiotherapy. You were accepted into AUT in Auckland, but life had other plans. After your brother experienced a serious workplace accident in your final year of school, you made the difficult decision to stay close to home and decline your AUT offer. Instead, you anxiously waited to hear back from Wintec in Hamilton, one of only 25 available spots in their brand new physiotherapy program. You were accepted and became part of the very first cohort of the Bachelor of Physiotherapy at Wintec, a milestone moment in your career. You began your studies certain you would pursue sports physiotherapy, inspired by the physios who had supported you throughout your own sporting journey. But university opened your eyes to the incredible breadth of the profession, from cardiovascular and neurological physiotherapy to older persons rehabilitation and post-operative care, stuff we'll touch on today. After graduating, you stepped into private practice and worked with a rugby team in the weekends, gaining hands-on experience and discovering a growing interest in concussion rehabilitation. 2 years later, you transitioned into a role at APM in Hamilton, where you now work under ACC contracts in pain management and concussion services. Today, you support clients living with chronic pain and brain injuries, work that is both challenging and deeply rewarding. Helping people re-engage in meaningful activities within their community sits at the heart of what you do. Physiotherapy continues to be one of the most requested career pathways by students, and that's why we got you, likely due to its strong links with sports and injuries that kids dabble with it in their youth. In New Zealand, there's around 5,500 active physiotherapists. Around a third work in private practice, the majority work in community settings. Over 70% are female, and the average income sits at around $88,000 for those who are interested. The University of Otago, AUT in Auckland, and Wintec in the Waikato offer 4-year Bachelor of Physiotherapy degrees, and the University of Auckland a 2-year Masters of Physiotherapy practice for postgrad studies. This career is for those who love health, sport, movement, training, and overall well-being, and it's for anyone exploring pathways with the healthcare environment who wants to understand the real impact of physiotherapy. We're excited to dive into your story, and I can't wait to hear it. And I know part of it was your brother's story, which obviously where we grew up was a massive event, and that may come up today. But can I take you back just to that school? I've already touched on you chose wisely with subjects. Some of our guests do, some don't. What are your reflections on school and how that went? And yeah.
Well, that was a good introduction. Thank you. Yeah, so obviously I knew from a young age that that's like the pathway I wanted to go down, healthcare. And then so the subject, like the sciences and the sports sciences made sense. But funnily enough, I actually excelled more in subjects that I would say are more like black and white answers. Like, you do a test and there's a right and wrong answer. Which in physio is obviously not that black and white. But yeah, I really enjoyed maths and the sciences, but then also took PE and sports science for like that fun balance, but also to learn more about the body. And yeah, but yeah, I love school, and I knew that I wanted to do physio and go into tertiary study. So I tried to, take every opportunity that I could to make sure that that was going to be an easy transition. But
Yeah. What else did you get up to at school, Jess? So a kid's sitting there going, okay, that's what the subject she got into. How bright were you? Because is this a career where, you'd suggest to kids, well, look, you've got to be aiming for these sorts of marks? And also, what else did you dabble with? I touched on sports, leadership, drama, music. Yeah, what else were you up to?
Yeah, so I played a lot of sport when I was in school, netball and hockey. I was a house leader in year 13. I did put a lot of pressure on myself to get good grades, knowing that I wanted to go to uni, but it was good to have that sport balance. But yeah, I think I ended up getting an excellence endorsement in all three, level 1, level 2, and level 3. And I think from memory, one year I actually got an award for like one of the highest amount of excellence credits in my year, something like that. So I did put like a lot of hard work into my study, and I really, yeah, like I held like a really high standard of myself that I really want to do well.
Like, did it come easy? Because like, that's one thing where some people, it's like they want it and they work hard, and you obviously worked hard, but were those subjects like natural to you? Were you finding, and was it encouraging your decision to go to physio, or was there ever any wavering? And again, no right or wrong, just curious how that was.
I don't think so. Like I always, I just love learning about, particularly the human body, and just like figuring out like why that happens. Like if I'd experienced like an injury or like something like that in sports, even learning about like the skills, like how to get good at a skill. Like I just found it so interesting, and I just wanted to do more and more of it. Um, but that doesn't say that I definitely tried very hard, knowing that that's where I wanted to go, and I think it made it easier that when you're passionate about it, it doesn't feel like you're doing as hard at work. You know what I mean?
Yeah, and obviously I touched on you were sitting there clear, you had a clear, you're an easy one. You're the kid who sits there. I remember sitting there going, I wanted to go teaching. So everything's easy. Your application, I suppose, initially you could tell us about to Auckland, but that's neither here nor there because you did get accepted. So that may be interesting if you remember how that application went. Obviously you're putting all your sports down, your endorsements you got. But then the brother incident and how that impacted, and then had you applied for Wintec, or did you suddenly apply for Wintec? Had you applied for both? Yeah, so even just talking through that process from going from year 13, the family incident, and how that all panned out for you.
Yeah, so I had been to the open day at AUT, doing that because I wanted to study physio, and at that time, Auckland was the closest, other than Otago. And then I'd heard whispers about the Wintec course, and so I inquired about it and ended up applying for both. So I don't remember clearly, but AUT was like you just filled in an application and with your marks and your experience and things like that. And then Wintec was that, but then also then you were shortlisted and you went in for an interview. And so I'd had the interview at Wintec, and then my offer to AUT was had like a deadline, and I hadn't heard about Wintec. But then Ryan had his accident, and then so I'd made that decision that I wanted to stay at home. If that meant I was going to stay at home for the year and work or do something else and then go to AUT the next year. I had kind of accepted that because I hadn't heard back from Wintec yet following my interview. And knowing there was only 25 spots in that first year, I wasn't feeling like overly confident that I didn't want to put all my eggs in that basket. So I declined my AUT offer before I'd heard from Wintec. And then I got my offer of place at Wintec. I think it must have been like mid-December. And then we were starting in February. But I remember the interview. So the Wintec course, they had a large emphasis on like community and rural health and those like a Māori Pacifica type focus as well. So I remember in the interview there was a lot of questions aimed at that about like health inequities and stuff like that, which made me feel more that I wanted to go to Wintec down that route because that was something that resonated with me about, those people that go to physios and doctors and stuff and can afford to pay the surcharges and have the insurances and all of that, but more focused on those people that find it harder to access healthcare and get that care they need.
The interview part, like, and again, I know this is what's hard sometimes is we're asking people to draw on things that were a while ago, but
Yeah.
do you recall when you went in for that interview, like how long it was? Like, did they get you to prep or did they really just say like, come in and we'll talk?
I think there was a few prompt questions or like things that we'd cover, but I think the aim of the interview was they wanted to get people who like were really people. Like obviously you can look at an application on a piece of paper and this person might be the brightest, smartest person with the best grades, but they wanted to have that like students that could really connect with people. And so it was more, I think, an interview on just not assessing, but like seeing what type of person you are, like what your communication style was like how you responded to questions and what your life experience kind of was.
They have that
Yeah.
in with Otago versus Auckland for the medical school. We found this as well as like, isn't it Otago that they just basically
Auckland.
mark
Auckland
with
has
Auckland's
Auckland.
interview, right?
Yeah.
Yeah,
Yeah.
so and is it so we're finding that there and like so if you're a student who wants to do medical school and you are more of a people person, like Auckland's probably better for you. And so it's encouraging and I wonder if they still do it with the Wintec or if it was just because it was the first year and it was so important. I imagine with 25 they still do it, but that is a really important element for people who hopefully you still have some good grades to help. But ultimately when you get into the field, it doesn't matter how good you are like academically if you can't communicate with your patients and have bedside manner and all of those things. So that's a green flag for Wintec and how you did it.
Yeah.
Yeah, and I must admit we had to have an interview for Teachers College, even though that was 5 light years away. I would imagine if you were not slightly worried, even for someone like yourself, if you went and spent time, if you could, at a local physio, asked to just observe, and it would be a great interview tool to be able to say, well, I've, every Thursday I've gone down and helped or supported, or like you did, become part of the rugby team, helped some, so I know that was later, but so all I'm saying is there are ways to approach interviews and actually have a head start. That's for sure. Can I just touch on, if you don't mind, because I think this is relevant, Ryan's accident, your brother, for people listening, Grace and I know what happened, because I imagine a lot of his care afterwards is very physiotherapy based. So what was that accident basically, and what did his recovery look like? Because through the eyes of someone training, because I imagine you were training to be a physiotherapist as he was actually going through physiotherapy. And so you would have been learning in a sense when you went home at night to see him and what he was up to. Do you mind touching on it?
Yeah. So he ended up having injuries. So I had like a crash injury. So broken ribs, punctured lung, internal bleeding, and then he broke his pelvis quite badly. So the pelvis is like 2 bones. It can either go up and down or it can like butterfly, and butterfly is worse. And his butterflied. So he had a big surgery and they stabilized it. And so he wasn't allowed to weight bear through his feet for 6 to 8 weeks, I think. So in hospital when you're not walking or like putting weight through your feet, you lose a lot of muscle really quickly. And so he was just muscle deteriorating kind of thing. And so it was really cool in the hospital once he got cleared to start weight bearing, like the physios coming in and getting him standing. And then with the injury, he had a nerve injury to his foot. So he can't lift his foot anymore. And so learning to walk again and being able to walk again while building the muscle, but also adapting to that neural injury was really cool. Seeing all the equipment and like how the team worked together, and then how that then progressed to getting him strong enough to be able to go home and like be independent again. And then following on from that in like a private clinic where they just continue to build his strength and get him back to doing everything.
Yeah. Okay, so taking all that, you enter Wintec.
Yeah.
You're doing, how many years is it?
4.
You do your 4 years. Can you go through those 4 years and go, look, a kid going year 1, it's going to look something like this. This is what you're going to learn. You know, if you can remember all of those years, just sort of even just basically outline what experiences and learning we're going to have if we enter physiotherapy.
Yeah, so in the first year, it's a lot of that like foundation knowledge, learning human anatomy and physiology, how all the systems work, learning the muscles and everything. I remember on our first few weeks, I was feeling like super confident. We go into this class. It was applied musculoskeletal studies or something like that, and the tutor starts talking about like the supraspinatus, the infraspinatus, the subscapularis, and I'm like, whoa. I've never heard of these things in my life. So yeah, just learning, I guess, that foundation stuff, and a lot of each year we did a multi-paper as well, or like a cultural paper, because the cultural responsiveness was a big focus of the course. So that was really interesting. I actually really loved that, and it helps to be able to interact with all types of different people, which is cool. So yeah, those first years, that foundation, and then the second year was, I guess, building on that more, and that's where it became more like not like specialized, but more streamlined into the different types of physio that there are. Mainly, the main 3 that we went through was the musculoskeletal physio, the cardio physio, and the neuro physio. So
can you do that one again, Jess? Sorry for me. It's physical. So that's the one most people know. I tear something. I've got a hammy. Grace's back. Something like that.
Yeah.
That's
So
that.
like the sport injuries type stuff, the muscle, bone, and tendon injuries, really.
Okay. The next one is
The cardiorespiratory physio.
what's that?
So there's like a different elements of it, but like working in ICUs. So physios work in ICUs when people are on ventilators, and like changing the ventilation, getting them so like the mobility when they're ventilated, getting them, like keeping them mobile is really important. And then in conditions like asthma, and we could do like breathing education, people with pneumonia and stuff like that, doing like coughing and breathing exercises. And you can do, well, I remember one of our exams was like secretion clearance. So you'd do like suction. So whether someone was ventilated, if they get secretions in their trachea or something like that, the physios come in and actually do suction and stuff like that. So yeah, really cool. And I never even knew that was a thing.
No. Well, I'm about to say the same for the last one. What's the last one? Can you explain as well?
Neurological physio.
What's
so
that?
that's if someone has like a stroke or brain injury, or like those like neurological conditions, Parkinson's, things like that. Doing rehab with them.
Where does and it keeps coming up, so anyone who listens to every episode is going to know about my back injury. Yes, is that ever following it? Where does like I have a herniated L5 and a bulging L4? Which one is that going into? Musculoskeletal? And what would you do? Like, is that the one you're in?
Kind of a crossover. So I work in chronic pain and concussion.
I know we're gonna get there, but I keep trying to get just free physio advice wherever I can.
But cool thing. Are you having like referred pain down your leg? Like you having
I like sciatica.
like this?
Symptoms. Yeah, it was pretty bad. And I
Mhm.
when I would sit for like 10 seconds, it would like stop. But we've made
Yeah.
progress. And now it's like centralized. But that
Good,
was
yeah.
the big problem of why it took so long because I would keep being like, it's my hamstring. My hamstring
Right.
hurts so bad. And then I was like, oh, my butt hurts so bad, but I never thought it was my spine.
Yeah.
Because I'm learning the little things, but it took like an MRI to be like, oh.
The human body is insane.
No, I'm going to say it's funny because this must happen to you all the time, Jess. It's like teaching. You're at a party. Well, you're not at a party if you're a teacher, are you? But and as soon as you say teacher, they've got a story. Oh, I hated this teacher, or I love this subject. And it must be the same with physio. You must all the time. Oh, I'm a physio. Oh, I've got this bloody ache in my side, and I've got. Is that true?
I was at a funeral last week.
Oh.
Someone came to me. Oh, I've got a physio question for you. Oh, what?
I think we've hit something good here because it seems to me like there's the three types, and you could be a master of all. Absolutely. You just said to Grace, I'm sort of a couple. You can do the muscular. You could be literally, I'm presuming a sports one will be number one, the bones and the muscular. The cardio is a really interesting one, and I'd imagine there'd be some incredibly specialized people where that is their absolute gold, and they're in ICU or wherever, and then that neurological as well. So during your studies, you're learning all three, and are you getting towards the top of the pyramid when you graduate, choosing one of those or some of those, or do you leave good at all three until you choose a job? How does that work?
Yeah, so you do like the foundation basics of each of them. And then in your at Wintec, in your third and fourth year, you go on placement. So in third year, you do 2 5-week placements. And then in your fourth year, you do 2 8-week placements. And so they try and make sure that in those 4 placements, you at least get 1 cardio, 1 neuro, and 1 musculoskeletal placement. So then you can kind of see what you enjoy doing or what you don't enjoy doing. So when in my second year, I think when we first were exposed to the cardiorespiratory physio, and the neurological physio, I was like, no, this is where I want to go. Like I want to go into the hospital. I want to do that. And then yeah, those jobs are pretty hard to come by because, like you say, it's quite specialized, and then it is quite a like gruesome part of physio as well. But yeah, you come out with kind of that like baseline knowledge, and then you develop as you go along, depending on where you find work.
So in terms of kids sitting there going that they're into physio, they're considering it, is it pass fail? Are they like in med school cutting kids in level 1, 2, 3, 4, and you're noticing your mates are disappearing because they're too lazy? Are you being tested with like tests and recall or essays or like something else? And how hard is it? I suppose. So yeah, pass fail, tests, essays, assessments. Yeah.
Yeah. So it is a mix of everything. So, well, for Wintec, once you're in the 4-year course, you're in. So, like, I think I think it's Otago, you do like a health sciences the first year with everyone, and then you do it. But then with Wintec, once you're in the course, you're in the course. Obviously, if you fail a paper, you'll either have to redo it. Like I know some of my peers did summer school to pass a paper, for example. But yeah, so throughout the year there's essays and assignments, presentations, and then we had quite a few practical exams. So you'd go in, and it would be specific on like you'd go into your cardiorespiratory practical exam, for example, and you'd get a case study, and then you'd go into a room and you'd have a patient lying there, obviously like acting. And then based on their like case presentation, you'd have to say and demonstrate what you would do to assess and treat them. Pass fail, particularly on things like I remember still was like drilled into my brain. Consent, washing your hands, and putting the bread brakes on were like all like pass fail type type things. But yeah,
Well,
Yeah.
that makes sense because that's one where in that environment you would go like, well, I know they're acting. It'd be easy to like skip over those, but it's really enforcing because I can imagine when you're actually working and you have however many patients in a day you've got to see, like those, like you said, it's drilled in your head. Those consent, putting the brakes on and washing your hands do need to be like at the foundations of it. So it's clearly effective. Like it sounds like this WinTech course, they've thought everything through, but I keep remembering you're the first like class going through it. So do you know at all, like, did they and this is just more curiosity, were they asking for your feedback? Do you know anything about how they refined it after you? Because that's a pretty cool but also big responsibility to be the first cohort going through.
yeah, there was like I guess you'd say like teething issues, and they were kind of working it out some of the time as we were going through, which is understandable. But I think that was cool. Like the tutors we had were all really passionate and like firsthand were learning it, but then also helping us learn, which was really cool. And then I think the WinTech course is based off a uni in Australia. I can't remember what uni it is. So it wasn't like a kind of from scratch type um, course, but yeah, still some learning blocks on the way. But the WinTech course as well is I'm actually not too sure if it still is. I think it might be. They do a block course. So you do 2 weeks of like full on classes, 8 till 5, and then you go away for 5 to 6 weeks and you have online tutorials with your tutors and stuff like that. But then also then a lot of self-directed learning, and then you'd come back and do another 2 weeks. So it was quite cool. Definitely learnt very quickly that yeah, you kind of had to do it. Not that you had to do it yourself, but I guess in high school you kind of have someone like ushering you along and like you need to have this done by this time and this done, and you need to do this in this lesson type thing. Whereas when you're kind of left to your own devices, you you learn pretty quickly like how you best study and having that motivation to keep on track.
And that's a good heads up for if you're not self-motivated, maybe it's not for you. It's been interesting too because of our health. We've had some really good healthcare type podcasts. The radiology sounds very similar. Once you're in, you're in, and I think there's some comfort for some kids to want to know. Look, I just want to know I'm in, and I don't like the competition too much. I've got to do well, but I know the nutritionist we had on. Equally, she did first year med at Auckland before she diverted off. So there's some similarities and differences. So now, we've got physio. Kids can actually piece all these together and sort of see where they fit. Can we talk job now? So when we graduate like you, and then how did that go? How did you, preparing your CV, trying to get out there, how competitive was it? And how did you make your choice, how you saw yourself in that profession?
So I remember in my last year of uni when I was still studying, we obviously had our placements, but I got a job as a sideline medic for Cambridge High's First 15 through the local physio. So I was doing that on Saturdays, and then I also got a job as a physio assistant at the Waikato Hospital. Which was really cool, and that kind of gave me a bit of taste of both hospital settings and then the sports settings, and then obviously on top of that our placements, and then it was kind of I guess just deciding where I wanted to go. So it was between going to the hospital. So they once you graduate, they do like a new grad rotation. So you spend 3 to 4 months in a ward or a section of the hospital, and then you kind of move around over a 2-year period, which is cool because then you kind of get to experience everything. But then I was working as a physio assistant and then doing the sports stuff, and so I decided that I would go into the private clinic, which was really cool experience. I actually was working in more of a rural setting, which kind of aligned with what a lot of the stuff that we'd learned throughout uni in terms of like access to healthcare and things like that. So that was cool. And then I decided that I was going to go traveling for a bit. So took 2 months leave and went to Europe. Did some traveling around Europe, which was like so cool. And I'm like so glad that I did that. And just kind of stepping away, I'd never really, you go on holidays and stuff, but never actually, I'd always been study, get into uni, do my degree, get into work, So that was really, really cool. And then, I came back and decided that I wanted a bit of a change. So, and obviously working through the rugby stuff, developed a bit of a interest and passion for the concussion management side of things, and then applied at APM, which I actually had a placement at APM in my 3rd year. So I'd kind of knew what they did there, I suppose. But with ACC to work on the contracts, so the particularly the pain and concussion contracts, you have to have 2 years experience. So that was kind of really good timing in terms of working for a couple of years in the private setting and then moving towards that where you'd kind of got that experience and then could go into that more, I wouldn't say specialized, but just having that experience after uni to be able to deliver those services.
Yeah, I think you're really right. I mean, that whole something you stated, school, uni, work, without the travel, because some kids are going to travel straight after school. If you're Grace, you're going to do that for the rest of your life. But to slide that in there is that's a cool heads up in a sense, because you could have embarked then on a 20, 30-year career and not had a break. So I think that's really cool, because I was going to ask you about work-life balance yourself. I mean, I sort of see what you get up to. You've got your own interests. So how on that question, I suppose, how do you maintain when you're dealing with people's problems 24/7? How do you maintain your own well-being and happiness?
Yeah, that was actually when I read through the prompt sheet, that was one of the things that I wrote down to mention was no one actually really like warned me or prepared me for every single person that's coming to you is in pain, and they could be or in some way like dealing with something. So like they could be the nicest person on the street, but at the end of the day when they come to you for your 30-minute appointment, they're talking to you about their pain and how it's affecting them. And when in my first couple of months working, I would just go home and I would be so exhausted because naturally when you go into healthcare, a lot of people are empaths. And so, I was taking that on and I was just like, oh my goodness, I don't know how I'm going to do this. And I actually went to therapy and worked through that and actually learned some strategies to almost essentially she described it as like putting myself in this bubble where, you're there working and it's your job and you're there to listen to them and provide them with support and like treat them. But you need to like separate yourself from that. So that first couple of months was a little bit difficult in that regard. But I think it's so important to have in any job, but particularly now have things outside of work that once I leave work, I leave it at work at the office, and then going to the gym and things like that are really a big part of how I keep that work-life balance and finishing at my finish times.
Yeah. Can I ask? This is a really, and I'm glad you mentioned it, because there might be also physios listening to this who need to seek help as well. Where did you go for that? Who paid for it? Because we all get to a point where we need support in workplaces, and if you're lucky enough to have HR, they might know someone. Or how did you do it? How easy was it?
I think so. I just contacted a counsellor directly. Someone had recommended a lady in Cambridge to me, and I just contacted her directly because I was prepared to pay for it or whatever I needed to do. But when I went to see her, we got I really don't know if they still do it or not, but the Gumboot Friday 6 free sessions for, I think it's under 25s. Yeah, so I just I did that, and then I did do a few sessions on top of that, just as like maintenance, I suppose. But that was so good in terms of just having a few little strategies for myself. But now as well, where I'm working at APN, we have the EAP services as well, which you can reach out to. So I guess that's the benefit of being in more of that like bigger company as well, as they have those supports in place.
Yeah. Oh, well, good on you for investing. That's all it is, isn't it? It's an investment, or else you wouldn't be doing the job anymore. Can I ask two things twisted together? A day in the life, I mean, getting up, go to work, X amount of people, so what does the day look like for you, start, finish? You even said you finish on time, hopefully. And then specifically, I think people will be fascinated with this concussion management. What actually is it? If I get knocked out, what are you doing with me compared to when I sprain my arm? So those two would be wicked.
Yeah. So at the moment, so my hours are generally 7:30 till 4. So a lot of the time we see people in their homes. So I do a lot of traveling around. Like on Monday, I was out in Thames, seeing clients. But so it really depends on where you're traveling to. If you're seeing people in Hamilton or around, you can see 5 to 6 people a day. But if you're traveling for longer periods, then it might be 2. It really depends. And then under the pain service, I'm what we call a key worker. So I do all the liaising with everyone involved, all the disciplines involved in the person's care. So psychologists, pain medical specialists, occupational therapists, dietitians, things like that. So I liaise with all of them. And then I also liaise with ACC to give them updates. We write quite a few reports when we first triage the client. And then when we start their service, we write a report on like a plan on what we're going to do with them, and then we write progress reports, and then we write completion reports when they finish their services. So there is quite a bit of admin sometimes as well, depending on what your role is. And then in terms of concussion, is there anything else you have any?
No. What I find fascinating with that is if I'm in a physio, I'm going to call it a shop, a physio place.
Clinic.
I can imagine they're getting churned like every 30 minutes, a new customer. You've got a cool job. Could be 2 to 5 people. And that in-house, we had Gemma Thornton who went and worked at homes with people. So that real personal care, I kind of like that. Now I've got lost where I was. The concussion management. Sorry.
Yeah. So for example, when I was in the private clinic, you're right, you do 30-minute appointments. So you could be seeing 16 people a day if it was full. But then in terms of concussion management, so essentially if you knock your head, there's like a multitude of things that it can affect. So it can affect your balance, it can affect your visual system, it can affect your neck. So a lot of people who there's a big crossover with people who hit their heads, and then if you think about commonly when people hit their head, they have like a whiplash. So there's a lot of neck involvement a lot of the time. And then our vestibular system as well. So there's like a little system in your inner ear that keeps the world steady for you. So a head knock can disrupt that system, which then leads to like most commonly dizziness. So depending on what people come to me with, commonly they'll have headaches, visual changes, dizziness, and then assessing and treating diet.
Right. Wicked. You're going to love our podcast from Josh Kirsten, Grace, with all the
Oh, but the
technical.
hyperbaric chamber. He's another person. I was like, is there room for me in my back? But just quickly, and this is maybe taking a sidestep, but like you had mentioned the job now was like the second placement you had. I don't want to forget these placements that you had. Was that facilitated by Wintec, or did you have to seek them out?
Yeah. So that's part of the course, and Wintec just organise with providers where you're going to go. So I'm actually having a student from next week for 5 weeks, which from Wintec, which is cool.
That's amazing. Yeah. Wow.
Yeah, experience. Like it's so good. And they do it at Auckland and Otago as well, but I'm pretty sure theirs is just in their last year that they do the placements.
I think they spend longer in their final year, but I actually really like that at Wintec it's 2, because there's certain things that you probably want to discuss with your tutor, and even if anything, maybe we can have a curriculum change, having the more of those was it the PT, I think, the physical therapist, I think, Ludlam, personal trainer, I mean, who talked about they had specialty days, Jess. So it wasn't worth a whole paper, but they had to do like 5 electives where it was like lifting with the back injury or like postpartum something. And even though she was a personal trainer in there, you almost wonder if that would be beneficial in something like physio, like if one of the days could be emotional management, like it's not worth a whole paper, but because that's a really tangible piece of advice you've given, which thank you that you did, is like there's a toll to being people come to you with a problem, and with head injuries I imagine it's even harder because like it's kind of hard, it's a bit not subjective but slightly. If someone's dizzy, how do you really assert in that? Like how, if someone came to you with a concussion, the symptoms, how do you first go about assessing, I guess, the severity of it and then making that plan that you talked about?
So essentially, like when they come into their initial concussion assessment, you ask them like all the symptoms that they're experiencing, and then this is really horrible, but like my job is to bring their symptoms on. So there's a whole heap of tests that you can do, and essentially you have to bring their symptoms on by performing certain tests to then ascertain whether it's related to their vestibular system or related to their oculomotor system. So a lot of people leave my assessment not liking me, particularly if they're dizzy or like I reproduce their headache, but I'm like, I'm so sorry, this is my job. But yeah, there's a like a phrase we often tell people is, if you like imagine a campfire and the concussion is the fuel that you're putting on the fire, and the fire, like the flame, is your symptoms, but the wood under the fire and how big that fire is going to be, there are so many factors. So if someone is like stressed or have been through emotional trauma, or there's all these other things on, the more severe the concussion symptoms are going to be. So it's kind of weaving out what is caused by that like nervous system stress versus like the true concussion symptoms. So it's a big puzzle.
Yeah, you're body investigator, aren't you, really? Because you're right, there's one thing that presents in one person, but there's another person with exactly the same thing. But if they've suffered it 15 times and they also have a bad hip and a bad back and they've had trauma and it's exponential. But if you treat them the same, you're not going to get a good result, are you? So I'd imagine it's quite fascinating. Have you ever had absolutely difficult positions, head scratching situations where you're going, I got no idea?
Yeah, quite a few times. Because like there's just symptoms, for example, that like would potentially be quite concerning. And we're at the stage where I'm at. I have a supervisor that I have a meeting with every fortnight, and we discuss difficult cases or things that I'm questioning, which is great. It's what people tell you versus what you actually can find on assessment sometimes don't line up, and it's just kind of taking some stuff with a grain of salt type of thing. But at the end of the day, a lot of people, particularly now I'm working in pain, if you sit and listen to them, and it's so great in our job that we can allocate as much time as we like, pretty much, to spend with them. So if we spend an hour and they just talk, and sometimes that's what they need someone to listen to them. So it's cool to really be able to have the time and have that space for them to like tailor the support to what they need.
Wicked. So if you were sitting there now, because I think a lot of students would be loving this, if you were going to, I think you've touched on some of it. There's certain subjects, if we go right the way back, there's certain subjects at school you'd recommend. In terms of personality and skills for the job, if you were saying to that kid, right, take these types of subjects because they'll prepare you well. It's not life or death. You can still get in if you need to. But also, what sort of personality traits, what sort of, resistance do you need in terms of dealing with the day-to-day as a recommendation for young kids?
I guess honestly the biggest thing is that communication. Like if you can make someone feel comfortable and people will open up to you and talk to you and share things with you. You've got experience with dealing with difficult situations where people are potentially feeling resistant and just being able to like mitigate that. But then also work with someone and see like their potential and their goals that they're trying to achieve, really work with them with that. So yeah, like the grades and stuff like that aren't the biggest factor, in my opinion anyway. Yeah, it's that having the knowledge, but then being able to actually put that into practice and make it patient-centered and tease out what they need.
Yeah, and you've just nailed it again, because every single time we had some wonderful med school students. I don't know whether you remember, Grace. We had Anna Smith. We've had the nutritionist, and to every single one of them, we've said, if we end up in a bed or in a situation, you're the exact person, because I suppose in a sense it would have been easy for you to go, it's all about the body. And a kid who loves, bones and tissues and ligaments, you're going to love the job. But you instantly went, no, it's not really about that. It's around the person.
Yeah.
And it's such an insightful way to look at this career. So I just shout out to that, because I think that's brilliant. And again, you'd be the one I'd want to talk to, because at least I know you're starting from that point. Before Grace wraps up, I just want to thank you so much. When I said that to you and said, do you know a good physio? And you went, well, I might do. It made my job easy, and I know it's been difficult to try and get you, track you down for a good time, but I'm so stoked that we got to share your story, and your insights for kids is second to none, and even the WinTech course sounds really cool. So a great representative for that. But thanks so much for your time, and really great to see you.
Yeah, you too.
Yeah.
I have one question and then like the sign off question. But before that, I do want to, again, as Latham said, shout out you and what you've exposed with WinTech, because I think a few good friends of mine like went to AUT, and I'm sure if they had the option to go to Waikato or like they might have, but that wasn't because obviously I think you're just the year below me. So it's cool. And we're seeing the same region is also having like a med schools now coming out. So all of that stuff is right. It's like just super encouraging. And so I guess students as well, it's like, we're not saying there's going to be one pop up in each region, but don't just look at what's out there. Maybe do some research and talk to people about what's up and coming, because obviously you did and it worked out great. The question I had too, though, kind of about continuing education, is there some sort of like requirement? I know sometimes in like the lawyers have it and other people where they have to do like 10 hours a year or something of upskilling, continued education. Is that something you have to do as a physio?
Yeah, so we do have to do we call it CPD, so continued professional development. So you can you kind of just keep a log of it. But there's like courses that you can do. So I'm doing a course in a couple of weekends time, like a vestibular course. But like reading articles, watching webinars, we do at work, we do like focus groups, and things like that, which all is like continued learning, which is so cool because the research and the everything changes all the time. So like keeping up to date and finding new tools and things like that for your little toolbox is so cool.
I love
Add
it.
to your journal about Grace's L5 disc you dealt with on a podcast you recently did.
And you immediately, you ask, you're like, is it something? I'm like, yes, I'm getting so much empathy from these interviews. Thank you. But mine definitely came from rowing, Jess. That's like, and then this is slightly off topic, then I'll be back on topic. That whole point you said about kind of ascertaining or like understanding what they're saying with a grain of salt, it also works the opposite, because I think I've been in pain for so long. Now that I'm getting out of the pain, I didn't realize how much I was just always in it. So when they would ask how much it hurt or what was hurting, it kind of muddles. So you must have that sometimes too, where it's like the opposite, where people don't realize it's not normal. So it's so difficult for you to try figure it out.
Yeah. And with the chronic pain, like 9 times out of 10, when they're now in the chronic stage, the actual injury itself is healed. And so you're retraining that like neural pathway that the body is not injured anymore, and there's not the reason to be sending those pain signals. So yeah, there's a lot of education and like working backwards into the pain service, which
it kind of makes me think a bit of like the phantom limb issues, where people are experiencing pain because the brain and the nerves still think it's there. So they'll do some bizarre therapy of like having a mirror make it look like the limb's there. So your brain, all of that. And when there's a phantom limb, it's not there, but you still experience it. So it shows how complex the body is. Just fascinating.
I do therapy quite a bit actually, because we treat a lot of what we call complex regional pain syndrome, where like someone will develop like this pain syndrome, particularly of their feet and limbs. So yeah, you do therapy to help that, which is fun.
Wow. Okay, before I ask the sign-off question, is there anything, Leatherman, I didn't ask you that we should have? Because I feel like there could be quite a bit, but what does anything come to mind?
No, I think covered it pretty well. There's always more, but
Part two. Last question we always ask Jess is if you could go back to yourself in year 13, so not advice for everyone because you've given so much, but you to you, what advice would you be giving yourself?
I think make sure I have fun, make the most of school, but don't feel like I have to do things just because everyone else is. Like a lot of my friends and a lot of people I knew moved away, and I knew that I knew in myself that I wasn't ready for that, and I'm glad now that I didn't stay around home. But yeah, don't just do what you want to do. Find your passion and do it.
What better thing to do on your day off than chat to us? Brilliant.